This is the Louisiana Hometown Network, traveling the state to bring you the important issues and events.
This is the Louisiana first ever statewide health summit. We're very pleased to certainly give our time for this great cause. This is so important because, as you know, healthcare is on the lips of everyone. This is a time when people are hurting, and our governor has, for the first time, signed an executive order to expand Medicaid. So it gives us now the opportunity to really shape something in Louisiana that will take care of all of our people.
This statewide summit is necessary because we need to bring people together who care about Louisiana and who care about the health of our state and the quality of life for people in Louisiana. We are 50th, ranked 50th in the nation, and we can do better. And this is an opportunity for us to engage many people on a state, local, national level in informing the discussion about health care.
We welcome you to the first ever 2016 Louisiana Statewide Health Summit. The agenda today, or the theme today, is creating an agenda for a healthy Louisiana.
Pardon if my voice wavers. I have a VNS and it affects my voice sometimes. My name is Storm Matthews and I'm a teacher for East Baton Rouge Parish. I have medicine-resistant epilepsy, and I've had several generalized seizures that have left me severely unconscious. I've gone to Our Lady of the Lake Hospital, and even while having seizures in the emergency room and had people call out for help, there was no doctor available to come deal with me having a seizure in the emergency room. I've been told while in the emergency room that they were letting me go, not because I didn't need treatment, but because all of the beds were full and because they had 50 people in the waiting room. Even though they knew I needed to be admitted, but they didn't have room for me at that time. I used to work at Our Lady of the Lake, and I know that that is not the culture of that hospital. They are simply overwhelmed at this time. And when you are dealing with a situation as I am, where I have been hospitalized so many times because they didn't know how much brain damage I've had due to the massive seizures that I've had. And they constantly come back and they don't know what's wrong. And I have insurance, I work, and they still turn me away. What are they going to do with the people who don't have insurance? What are they going to do with the people who only have a minimal insurance? Because I have Blue Cross. And they refuse, the hospitals refuse to set up payment plans. I want to pay my portion, but they refuse to set up a payment plan. They say the only payment plan they can set up is $200 a month. Well, I'm a single mother with 2 children, one of whom is autistic. I can't afford $200 a month. I'm a teacher. We don't make much. So, as a mother of an autistic child, I am very used to advocating for him. But when you've just had a seizure, your brain is not really functionable. I need to know, and I would like to ask the governor, who is going to advocate for me?
Good morning. My name is Alicia Elzie, and I too work for East Baton Rouge Parish Public School System. I've served as a teacher for over 16 years. I'm now an instructional support person within our wonderful parish school system. I stand before you with a cast on my arm. On February 23rd, on the day that we had no school, I broke my wrist. And I thought, well, I am employed and I pay for health coverage monthly. That premium is up to date. I'm going to the emergency room as a normal person. never thinking that there was going to be a problem. I was close to my grandparents' home as I'm helping to take care of my 90-year-old grandmother. And I said, well, I'll go to somewhere close, as she lives in the Glen Oaks area. And so I drove myself, hurting and crying, to the LSU facility that is located on Airline Highway. As I walked in, the young lady asked at the desk, do you have insurance? I proudly said, oh, yes, ma'am. Hold on one second. Let me get that for you. I was told immediately, did you know that you are out of network coming here to be seen? I stood for a moment as I had seen a young lady previously exit the facility, and she was a teacher friend of mine. I realized that she left because she could not afford to pay out of pocket. I said, well, Lord, I'm crying and I'm hurting. I said, well, what do I need to do? She said, you're going to have to be billed and pay out of pocket because we cannot take your current insurance. So upon making the decision, I was billed for quite a large number of dollars because I required x-rays and several scans and things like that. And so I'm here today just to say that as a state employee, I make over 1,000 children my number one priority. And so my question today is, who makes us their number one priority? It's an atrocity in our great state that as a teacher, as an educator of our future, we cannot yet seek and attain quality health care. And it's unbeknownst to those of us who can even sometimes afford to swipe a card and cover it and take care of it. There are many in our communities who cannot. And so I ask you to be thoughtful today and consider those who cannot advocate for themselves. Thank you.
It really does make it real. These are educators. These are professional women in our community. They are paying premiums monthly, state employees, state health coverage, and the state emergency location, LSU on Airline, would not take the state coverage. In Storm's case, Storm Matthew sent home not because she didn't need to be at the hospital, but because with too few hospitals, the hospital was overwhelmed. No room in the inn. We've got some real work to do.
Louisiana is a great state, and our people are among our greatest assets. Our people are diverse in race and ethnicity. We are a resilient people, having faced numerous catastrophes and disasters. Our culture is like none other, and yes, our culture is an asset. Is there room for improvement? Yes, absolutely. Louisiana is struggling with a budget crisis, the largest in the state's history. Louisiana ranks last according to the most recent America's Health rankings, even in the face of some improvements such as from 2014 to 2015, disparity in health status by educational levels decreased by 17%. In the last 2 years, preventable hospitalizations decreased by 16%. In the past 20 years, cardiovascular deaths decreased by 26%. So we are making some positive gains. However, among our challenges are that in the past 5 years, children in poverty increased by 73%, and Louisiana has the highest number of children in poverty in the country. In the past 5 years also, public health funding decreased by 33%. While much has been done to improve the state's health outcomes, Louisiana's overall ranking has fallen. The good news is we can fix it, and we must fix it. Last year, the Louisiana legislature passed H.C.R. 170, authored by Representative Patricia Haynes Smith. The study calls for an evaluation of Louisiana's statewide healthcare system. The committee convened in July and is focusing on workforce, service delivery, and healthcare financing. Also happening last year were regional community needs assessments conducted by the Department of Health and Hospitals. Regional priorities were developed, and subsequent state priorities for the state's health improvement plan followed. This health summit program agenda was developed around these two key initiatives that are taking place in our state. Healthcare is one of the largest portions of the U.S. economy, and it's a major driver of the economy, both nationally and here in Louisiana. It is also an industry with widespread issues, such as the rising cost of health care. In the Affordable Care Act era, one thing is clear. Health care has become much more politicized, and that's unfortunate. Political and partisan ideology often stall workable solutions and improvements for reasons that are debatable. It is much clearer, though, that political ideologies, being progressive or conservative, your political party affiliation, often trump scientific evidence and facts, and ultimately what would be sound public policy. Let me give you an example. The Affordable Care Act created financial incentives for states to reform healthcare delivery to make access to healthcare affordable for everyone. One of the ACA provisions is Medicaid expansion. For 3 years, Louisiana rejected Medicaid expansion with compelling evidence for it. In January, Governor John Bell Edwards signed an executive order for Medicaid expansion, making Louisiana the first state in the Deep South to expand Medicaid under the ACA. It's never too late to correct a wrong. And now we have the evidence on the benefits of Medicaid expansion. And there's lots of literature emerging on the benefits of Medicaid expansion. And we're going to talk a lot more today. You're going to hear from many of the experts on that subject. Another issue is special interests. The more affluent, prominent, or wealthy constituencies often dictate or dominate public policy, where and how services are delivered. We have seen the evidence here in Louisiana in the elections, for example, with out-of-state special interest groups influencing elections. I won't be specific, but I'm sure all of us can think of examples of where that has happened on the state and on the local level. We saw it right here in Baton Rouge. Right here in Baton Rouge, we have we are in the midst of a very public debate about access to health care. North Baton Rouge saw the closure of its hospital, the charity hospital, Earl K. Long Hospital, in 2013. We have also seen the closure of the Mid-City Emergency Room and the Women's Hospital that was located in that area of the city moved to the outer edges of the parish. So this has resulted in a void of especially emergency care in North Baton Rouge. We see an emerging debate about the need for a hospital in that area, or at least emergency services in North Baton Rouge. A 1988 Institute of Medicine report defined public health as what society does collectively to assure the conditions for people to be healthy. Schools, hospitals, restaurants, businesses, universities, and other organizations should be part of the solution to improve health and to achieve an overall goal of creating a healthier Louisiana. Currently, there is much focus on value-based care and delivery. A New England Journal of Medicine article says, in any field, improving performance and accountability depends on having a shared goal that unites the interests and activities of all stakeholders. The article goes on to say that in healthcare, stakeholders have many and often conflicting goals, and that the lack of clarity about goals has led to, among other things, slow progress in performance improvement. The same article goes on to say that cost reduction without regard to the outcomes achieved is dangerous and self-defeating, leading to false savings and potentially limiting effective care. Such practices that fail to recognize the existing social and economic factors, the economic realities, are problematic. And we've seen this in our state, and we continue to see this in our state. If public health funding, as I mentioned earlier, decreased by 33% over the past 5 years, what kind of outcomes should we expect? A system that's focused on value without values can be detrimental in many instances. And I've given you a couple of examples of such with Medicaid expansion and the refusal of Medicaid expansion for 3 years, and the closure of a hospital in an area of the city that needs it the most based upon the demographics of the area. If Louisiana is to become a healthier state, shared values need to lead our efforts and our progress. There is a need for core values, a set of principles to guide public policy, to guide healthcare financing, program implementation, and service delivery. Some of those core values could be equity, collaboration and transparency, coordination, continuity of care, consumer-focused and consumer participation, and citizen participation, accountability, and yes, a focus on outcomes. Let's talk about equity for a minute. Equity as a core value would change the landscape of the way we provide healthcare services. Where you live should not determine your health outcomes. Your income should not determine whether you have health care. Concepts like personal responsibility, measures like co-pays and cost sharing take on new meaning in the context of the financial realities of those impacted. Cost containment and cost reduction, which has permeated and led in healthcare and healthcare service delivery over the past, at least the past 8 years, if not preceding that. Cost containment and cost reduction for programs and services that benefit the poor are likely negatively impacting health outcomes, and perhaps it's why Louisiana has dropped to 50th. And in fact, the reality is it's really costing more. It's costing us more because of people getting health care later at advanced stages and utilizing the most expensive services like emergency care. And it's costing us in human lives. More people are dying, and that is a fact. While we talk about personal responsibility, and I'm all for personal responsibility, I believe strongly in personal responsibility, but we don't talk about responsible government enough. And I think we need to change the dialogue, change the narrative, the conversation, and we need to start talking about smart and responsible government and sound public policy. Governments at the state and the local level need to work together to provide essential services with better outcomes to produce better results for taxpayers and for those who rely on government services. And we all know who relies on government services, right? Everybody in some way, but when we talk about health care, it is primarily those on the lower socioeconomic spectrum. So where do we begin? Where do we begin? I say we start by investing in Louisiana. What are some of the challenges for us going forward? We certainly have a system that needs to have more consumer and civic engagement. We need people ideally in the forefront leading the development and the policy and framing the policy agenda. And that is why I'm so happy that all of you are here. We need to have more accountability with explicit system outcomes and evaluation and reporting. We need to know what it is that we are trying to accomplish and how it is we intend to get there and how we will know when we have arrived. We need to have statewide data and information that is easily accessible and readily available for people who are trying to do great work, such as many of you, that can help to inform the work that we all do. And I'm going to kind of close here because I know my time is up. I'm going to close with, we need more collaboration. We need collaboration at all levels and incentives for all of our stakeholders to work together. We need to broaden this debate, and we need to break down the silos. And today, we continue in that effort, and we are so happy that you have chosen to be a part of this conversation. And we hope that it's not just for today, but that you would continue to be a part of this conversation. Thank you.
I want to thank all of you for what you do, and I know that you're passionate about health care, as am I. You know, we're all creatures of our environment and our upbringing. My mother was a registered nurse, an RN, working in an emergency room at a charity hospital, and she retired from that. In fact, I'm going to leave here in just a little bit and go have lunch with her. But she told me and my brothers and my sister every night how important it is that people have access to quality health care, especially the people who struggle the most in order to afford insurance or to access care. And those were the people that she took care of every day. And so I bring that mindset to the governor's office as well. So I actually have a history related to Medicaid expansion that predates the election and predates the campaign. For 3 years, I filed legislation in the House of Representatives here in Baton Rouge to try to force the Medicaid expansion because I believed it was the right thing to do. And I thought the worst thing we could do is wait. Because the longer we wait, the more money we leave on the table, the longer we go without people having access to health care, the longer we put pressure on our budgets, the longer we put pressure on our hospitals and other providers, and the longer we wait before we can have better health outcomes for our people. And for a state that has more than its fair share of poverty, more than its fair share of people without insurance, has the least healthy population in the country, or at least we're right up there at the top of that list, and have some of the worst health outcomes, it just didn't make sense to me to keep waiting. And I understood that the Governor General's opposition was related to whatever it was related to. I just didn't think it was in our best interest. So I filed that legislation for 3 years, and it was very distressing, but I didn't find a receptive audience in the legislature. And quite often people would vote against the bill, but in private conversations they would tell me, oh yeah, we know we're going to have to do it someday, but we're just not going to do it today. And I kept asking them, I'm like, okay, so when you want to make a decision to buy a stock and you know that it's cheap today and it's going to be more expensive tomorrow, you're going to wait till tomorrow to buy it? That's not what you do. But ultimately, we weren't able to succeed in the legislature over the past few years, and that's why I will tell you it gave me great satisfaction knowing that I was doing what was right for the people of Louisiana. When one day after I was inaugurated, on January the 12th, I signed an executive order expanding the Medicaid program to 138% of the federal poverty level here in Louisiana. We are on track. It is difficult, as you know, but we expect that we'll have more than 300,000 people enrolled in the Medicaid expansion. We will actually start issuing cards 1st of June. And the expansion itself, in terms of accessing care, starts on July 1st, the first day of next year. And so I want to talk to you for a few minutes about ways that I expect Medicaid expansion to benefit Louisiana. It's good for the people. I believe it's good for doctors and hospitals and other providers. It's good for our budget as well. How is it going to benefit the people of Louisiana? Well, when people have insurance, we all know that they're more likely to get routine preventative care and have a regular primary care doctor. That also means that they will stop relying upon emergency rooms to receive routine care. And we know that emergency room care is great for emergencies, but it's not particularly good at managing people's health. And also it is the most expensive way to deliver that health care. So we know that this is a step in the right direction. It allows individuals to get needed medications and to better control chronic health conditions such as diabetes and others. With insurance, women are more likely to get mammograms and other cancer screenings. And access to health care not only results in better individual health outcomes, it also helps to grow a productive workforce. And what we know around Medicaid expansion, here in Louisiana, 70% of the people who are going to get coverage through expansion, they are working people. You know, these are the working poor. They're just caught in a trap. They make too much to qualify for Medicaid today, but not enough to receive help to go out and get insurance on their own, or even through the exchange. So they've been caught in the gap, and that's who we're trying to bring into the fold. You know, for example, of the folks who work, we have nearly 30,000 employees in the restaurant industry in Louisiana who are eligible for expansion coverage, and 15,000 construction workers who don't have health insurance but will qualify under the expansion. So this is just the right thing to do for our people. And now I don't want to just give them a card for the sake of giving them a card. I don't even want to give them a card for the sake of saving the state money. I don't want to give them a card just so that those hospitals and providers get more reimbursement. All of those things are very, very important. I want to give people a card so they have access to better health. We had better deliver better health outcomes because that's why we provide it. And that is challenging, especially when you have a group of people who have been underserved and they have pent-up demand for a lot of health services in order to achieve a better health outcome. But we know that that's ultimately why we are doing this. And so it is the right thing to do for the people of Louisiana. You know, for me, and I will tell you, we just came through Easter Sunday. I believe it's the right thing to do for the least among us as well. I'm talking about Matthew 25. I'm talking about Luke chapter 10. What was it that Jesus modeled to us himself about what it means to be neighbor? We know it wasn't the priest or the Levite on the road between Jericho and Jerusalem who was neighbor to the robber's victim left for dead on the road. It was the Samaritan who stopped and rendered aid, poured oil and wine into the wounds, bandaged him up, put him on a beast, took him to an innkeeper, and paid the innkeeper money and said, "Take care of this man, and if it costs more than this, I will settle up with you on my return." Now, the example given to us by Jesus Christ himself as to what it means to be neighbor is to provide health care to a stranger on one's own dime. In Louisiana, we were paying the dime and refusing the care. Now, it would be arguable to me that maybe we ought not do the expansion if we could somehow avoid the cost associated with it. But if you're paying and refusing the care, well, let me tell you, that's wrong on every level that I can think about as being wrong. And as a Catholic Christian, it offends me as well. So I know that we are on the right side of that issue today. And that is why we have to work together to make sure that we are neighbors to one another here in Louisiana. Because what happened 2,000 years ago on the road between Jericho and Jerusalem is interesting. But it isn't as important as what's happened on the road between Bogalusa and Bossier City, between Amite and Abbeville. You just pick the two places and they meet. We got people lining the road in Louisiana today, and that's what we better be concerned about. Now, it's also good for our doctors and our hospitals and our other providers by ensuring that more reimbursement dollars get to them and they remain viable. They can keep their doors open. They can hire people. They can provide these services. And you know, right now, even as I'm talking to you, we have folks from the Department of Health and Hospitals giving testimony to the a subcommittee on the Appropriations Committee, talking about the challenges we have around our $750 million shortfall. And right now, with that level of cuts, we are going to struggle to keep our safety net hospital system alive, the one that my mother worked in for 30 years. And in fact, right now, we estimate we have the money to keep 2 hospitals open, and we're going to prioritize the hospitals that are important for graduate medical education, those being in Shreveport and New Orleans. And so we have to do what we can to keep providers in the business of providing health care, knowing the challenges we're going to have around the safety net hospitals. Now, in truth, when we have the Medicaid expansion in place, and we have more than 300,000 people who are uninsured today insured, our reliance on the safety net hospitals ought to be decreased. But we need time to transition into that and do it in a way that serves the people of Louisiana. These budget constraints are not going to allow that if we don't raise some more revenue and keep those hospitals open and allow for an orderly transition to a new healthcare delivery model in Louisiana. So I am not satisfied with that testimony that's being given right now. I'm not satisfied with that plan. We're going to do everything we can to shore up these safety net hospitals and keep them operating. But with a $750 million shortfall, we simply cannot. So we have a lot of work to do, but this Medicaid expansion is more important today because of that shortfall and because of the challenges around our safety net hospital system than it would have been otherwise. I also want you to know that other southern states, such as Alabama and Georgia, have seen rural hospitals close because of their decisions not to expand Medicaid. And if you ever get a chance to look at it, and I'm sorry I didn't bring it to show it to you today, we have a map of the United States that shows rural hospital closures. And if you overlay that map of the United States with a map of the states that chose not to expand Medicaid, there is almost a direct correlation. Don't think that that wouldn't happen in Louisiana had we not expanded Medicaid, because it would. And in fact, we have a hospital, it's not a rural hospital, right here in Baton Rouge. Mid-City campus of Baton Rouge General closed its emergency room because too many people were visiting that emergency room without reimbursement dollars going to the hospital. And so it closed that emergency room. So now we have a situation in the capital city of Louisiana without a hospital to serve North Baton Rouge and downtown, because we've closed 2 hospitals there over the last few years. Well, we closed the Earl K. Long Hospital and then the emergency room at Baton Rouge General. And I'm working very hard to get an emergency room back open in North Baton Rouge so that we can better serve those people. But that would play out over and over across our state without the Medicaid expansion, especially in light of our current fiscal challenges. So understand that this is very important for our providers as well as our people. It's also good for stabilizing the budget. We're $750 million short. Now, that's the good news, I guess, because until a couple of months ago, we were $2 billion short for next year. Well, we had a special session. We raised some revenue. We didn't raise enough. We didn't quite get the job done. And so we're putting together a budget right now that has $750 million less in state general fund than we need just to provide the same services next year that we're providing this year. Not including inflation, not including more dollars for K through 12 education or merit raises for our employees. In the strictest sense of the word, a continuation budget only. Now, what we know is that in the first full year, next year, Medicaid expansion is going to save the state more than $100 million. So that $750 million problem without expansion becomes a $850 million problem. So we know that this is important for our state. It's estimated that by expanding coverage and taking advantage of the fact that the federal government will now pay for a majority of the cost of care through a much better match, we can reduce state general fund expenditures today and in the future. So think about the situation today. We're paying 38 cents on the dollar for health care in Louisiana, whether it's through the DISH program or through the Medicaid program. For those 300,000 plus people, we're never going to pay more than 10 cents on the dollar. Critically important that we make that move, especially when you know that DISH reductions are looming starting next year, and by 2020, those DISH reductions could hit us by as much as 75%. So we're avoiding, we're saving as much money as we can today, and we're avoiding those cost increases down the road. Incredibly important for our future. Especially when you think that for every dollar of DISH that we lose, if we don't expand Medicaid, we have to replace that with 100 cents on the dollar state general fund. Not just 38 cents, 100 cents. So it's the right thing to do. And I'm not here telling you it's the right thing to do as a way of justifying it or saying we ought to do it. I'm telling you why I did it and why we're going to benefit from it starting July 1st. Because I still have some folks in the legislature who don't seem to understand the importance of this for our state. They don't seem to understand how important it is for our budget, for our providers, or for our people. And now the good news is they're in a minority, but they have to stay in a minority in order for us to be successful. And that's where you can come in. You can communicate with your legislators, both in the House and the Senate, and make sure they have the benefit of your experience in this area, of your judgment as to whether Medicaid expansion makes sense. But I know that we're on track, and the folks in the legislature are much more receptive today than they were last year or the year before. Thanks in large part to your hard work in this area. So we're going to bring our federal tax dollars back to Louisiana to put them to use for our people, as opposed to those dollars going to Washington and then being allocated out across the 30 other states plus DC that have expanded their Medicaid programs. That just makes sense to me. Under the current circumstances, it makes more sense than ever. So it's incredibly important that we succeed and that we deliver better health as a result, and that we continue to reform our Medicaid program and make it work better for the people of Louisiana. We're going to do all of those things. I need your help to make sure that we are successful. So with the support of people all across the state and with the healthcare community, with managed care organizations supporting, with the faith community across Louisiana in support, we are well on the road now to expanding the Medicaid program in Louisiana, improving people's health, and improving our state as a whole. As members of the healthcare community, I know that you look forward to working with me for years to come to make sure that we are successful and we better serve the people of Louisiana. Let's together be better neighbors to the folks here in Louisiana with respect to healthcare. Your input and support are important in my administration's desire to build a better future for our state and for our children. And together, we are going to do that, even in this very challenging time. Because in times of crisis, it's actually more important that you get it right. I guess it's relatively easy to govern when the treasury's full and everybody's happy and you're just trying to figure out how you spend those extra dollars that you've accumulated. I dream about that at night. But in the meantime, and by the way, we're going to get there again. We're going to get there by working together. We're going to put this state on a path to prosperity, but without some shared sacrifice in the short term, that will not be possible. So I am calling for shared sacrifice as we get on the road to shared prosperity. But I need you to partner with me to make sure that we're successful, and make sure that while we go through this very turbulent time of all these fiscal constraints, that we do our very best to serve the least among us. So I want to thank you for the opportunity to be here with you today. Thank you for what you do every day. And if I can be of service to you, please don't hesitate to call on me and my administration. We look forward to working with you for years to come for the benefit of the people of Louisiana. And I know there's more to health care in Louisiana than just the Medicaid expansion. But right now, it is the single biggest initiative that we have underway. I know it's something that's very important to you. And so I look forward to working with you on that, but on many issues going forward, especially around mental health and other. By the way, I didn't cover this, but you know mental health has been covered since December 1st of last year in the Bayou Health Program. So by expanding the Medicaid program, we're also going to make mental health care available to that expansion population as well, in a way that is not available for them today. That is a big step forward in the state of Louisiana as well. And I've just looked at my watch. I'm supposed to take it off and put it down. I exceeded the time that Alma gave me. I apologize for that very much. Yeah. But I want to thank you all again, and please keep doing the good work that you're doing. God bless you.
When it comes to the subject of health care, it is complex. It is the type of subject every finger you point back at you. But it comes to also to mind growing up here in Louisiana that health care wasn't always equal when you're poor. And I've mentioned it around the country frequently when I go out and speak about leadership and the future of America, that if you're not poor, you're not free. Poor people don't get to pick what clinic they go to. Poor people don't get to pick their doctor. They don't get to pick what surgeon go operate on them. They don't get to pick what school their kids go to. And that continues to be a struggle here in Louisiana, because if you're not poor and you got good health insurance and you drive a Lexus, health care is not a problem for you. But when we see right here in our state, as revealed in 2005 when I came here to work Katrina, and I was trying to understand what we had seen here. I'd been here about 2 months, and I asked my Army surgeon to give me an assessment of what was the health care status in the state of Louisiana. And believe it or not, in 2005, Dr. Stewart, you can go get the report, published by the state of Louisiana, the state of health care in the state of Louisiana. And that was the year before Katrina. It was published in June or July. And when you look at that report, some of the statistics look like a third world country. So this issue didn't start yesterday. We've had a lingering issue that we haven't solved this issue with health care. My own experience, born in 1947 in a house on Lakeland Road in Poincapie Parish. I was number 8 of 12 children. So my mom had some experience at this thing of giving birth. And the only doctors I saw until I went to high school was the public nurse would come to the school and give shots. And that's when we were really poor and backwards. I'm going to say it one more time. The public nurse would come to the school and everybody would get their shot. It wasn't negotiated. Most of our food on that subsistence farm came out of the yard. Literally, right next to the house was a garden as big as this. And right next to that were the chickens that ran around the yard, and the pigs and the cow. We took our own milk. I'm telling you that because some of the systemic problems we have with healthcare today have been invented by the food we ate and where it comes from and how it processed, and is having a detrimental impact on our health. So the problem is just bigger than poverty. It's also a system that is built around those who are poor not getting an equal shot at health care. This is the question. And should it be? And some people will tell you from the amount of money that's spent on it, they think we're doing a good job. But those of you that deal with this every day, you know the challenges of the poor to get equal access to health care. I think it should be a human right. I've been around the world. I spent 9.5 years overseas. I've seen the amount of money this nation spend for goodwill. We build bridges. We build hospitals. We build schools. We build great buildings that have never been occupied in war zones. We buy tanks that's never been driven other than by the enemy. So we know how to waste money in other people's country. But when it comes to supporting the basic essence of life in America, it becomes an issue. And right here in Louisiana, we're in a hard time. And as you look at the paper yesterday, the proposed cuts, much of that is coming from where? Healthcare. That's a damn shame. And it will continue to be if we continue to accept it. How do you take $500,000 from kids with disability so Exxon can keep a damn tax break? That is ridiculous. That is totally ridiculous. So a Chinese company or a South African company coming here to build a plant don't have to pay taxes on the Caterpillar bulldozer they're going to buy, and we're taking money from kids with disability for health care. That is ridiculous, and it should not be accepted. These are multi-billion-dollar international corporations, because right at the other is a budget thing. If we didn't have a budget problem, we may not have an issue with whether we're going to have to take money out of health care. And it's a problem. And we got to figure out how we're going to deal with it. But number one is you don't have to accept it. Because if you sit here and you clap and you go along with the deal that they're going to take it out of health care, they're going to take it. You got to raise some noise. Right now, health care is in trouble because it's underfunded. We only have 4.6 million people, but some of the practices we put in and the delay on the Affordable Care Act, all those are coming with a bubble at a time our state is broke. But we've got to make a decision. I think we all wake up in the morning looking at our friends and families and ourselves, and our health come first. So we need to make sure we send a clear message to the people of Louisiana that health is first. But if you look at the draft budget cuts this morning, as was reported by the advocate, we're taking $500,000 from kids with disability. That doesn't sound right. And at the same time, we're leaving Exxon with a significant tax break. Something's not right in Louisiana, and health has to come first. Without health, you won't be able to learn how to read. You won't be able to go to school. You don't go to school, you're not a productive part of the economy. And that is a cycle of a failure we got to fix in Louisiana. And people need to have access to good health care.
In Kentucky, we expanded Medicaid as well as we took advantage of creating a state-based exchange. And we announced our expansion in 2013. And obviously with the first open enrollment, we began enrolling. Our uninsured rate has dropped from just under 21% in our state to 7.5% after this last open enrollment. And we have put about $3 billion new dollars into communities to healthcare providers for healthcare of the newly insured.
What kind of an impact has that had on the state budget?
Well, we're in a biennium budget session right now in our state, and our consensus forecast group looked at about $900 million new dollars over the next couple of years coming into the state. The other thing about Medicaid expansion is there are a lot of things that your general fund dollars are paying for now that you're going to get 100% match at least until January, and then after January you'll get a much better match on that money. For most business people in this state, I guarantee you that in 2020, if someone said to them, I'm going to give you $1 billion and I'm going to pay 90% of that, and all you have to do is come up with 10%, that would be a deal that they couldn't refuse, not to mention improved health of their citizens.
What have been the economic realities of states that have already expanded Medicaid?
Yeah, I think what you've seen is just an enormous infusion of federal dollars that have come in to support expansion, as well as covering hundreds of thousands of lives. I think expansion matters not only for the states in terms of the healthcare sector, but all sectors of the economy as well.
What kind of a budget impact can Louisiana expect from Medicaid expansion, not only this year, but in years ahead?
Yeah, based on my research in Alabama and kind of the fact that Louisiana is a slightly larger state, we'd expect to see billions of dollars of federal money flowing into the state that will fund health care for hundreds of thousands of uninsured Louisianians over the coming years. And obviously this will have an impact on state tax revenue that will largely offset the cost to the state of financing the program.
We at JSRI at Loyola studied social justice in the Gulf South states. So we took 9 quantitative indicators that were proxies for social justice in the areas of race, poverty, and immigrant exclusion, and we aggregated those scores on those 9 indicators for all states, and our findings were that Louisiana ranks dead last, 51st out of the 50 states in Washington, D.C., and we find that in particular, we rank very low in terms of average household income of our lowest income quartile, and we have one of the highest rates of uninsured in the country.
And did your report give any recommendations on what should be done about that?
Yeah, one of our biggest recommendations that's most pertinent to this conference is that the state should carry forward the governor's mandate to expand Medicaid without delay, without complexities, and without further debate. It is imperative, and it's a social justice issue, it's a moral issue, and it's an economic issue for families in our state that we expand Medicaid coverage to cover those who are in the most vulnerable among us.
After studying poverty in Louisiana, our recommendations are to support the Earned Income Tax Credit. We know that is one of the programs that actually helps impact families and help move them out of poverty. So we want to increase that Earned Income Tax Credit. We also want to continue advocating and supporting the expansion of Medicaid. There's too many of our community members that are suffering and need to be able to access health care. We're also advocating for an increase in minimum wage. Our families need to be able to have a living wage that are better able to support themselves and their families. But as we think about those in poverty, we have to include the LUS families and be able to look at those that are waking just a little bit above the federal poverty level, but need help. They struggle every day and they can't make ends meet. So we have to include those families as we think about programs and policy around poverty. We have to include the LUS families as well.
I am just excited. I am very pleased at the turnout today, the number of participants, the diversity of the audience. I'm very pleased that our governor was here and that we have people here who are speaking about health care, about health outcomes, people who are speaking about the economy and the fact that health care is a major contributor to the economy, and it just makes sense for us to provide health care and to make sure that our health care industry is stabilized.
This has been the Louisiana Hometown Network. If you would like more information, please contact us.